we start by trying to understand when people say about the impact of coccidiosis in a field. So what would be the difference within subclinical and clinical coccidiosis and the impact on performance for both?
Well, coccidia are obligate parasites. So it means that they need to develop inside the gut of the chickens, of the poultry, but they can develop with different levels. There are mainly 3 levels that can occur. They can develop without any pathogenicity, any impact on the birds, but we can also, and what is important for us, they can induce some decrease in growth and some increase in feed conversion ratio. In that case, it would be subclinical coccidiosis. And in some cases, but not most of the cases, it will induce some clinical coccidiosis. So the differences between subclinical and clinical coccidiosis is in the name. Subclinical is under clinical signs. So it means that the birds won't seem to be sick, but they will have some cells destroyed inside the gut. So the intake, feed intake and the nutrient intake will be lowered. So there will be an increase in feed conversion ratio. So this is the most important part linked to coccidia and coccidiosis. It's an economical impact with growth and feed conversion ratio. Subclinical coccidiosis is the most important, the most frequent. But clinical coccidiosis is when the development of the parasite is so important that it will induce some disease in the bird. So this disease will be characterized by prostration, fever, chilling, and also disorders inside the gut. So it will give birth to diarrhea, and it will alter the litter integrity. So in clinical coccidiosis, depending on the species, the species don't have all the same pathogenicity. Some can kill the birds, and some will never kill the birds. So in clinical outbreaks, sometimes you may have bleeding with 2 species, Eimeria tenella and Eimeria necatrix, and sometimes it can lead to mortality to the birds. So I think the clinical coccidiosis is a small part of the problem, and it's the emerged part of the problem, and the most important occurrence and impact is subclinical coccidiosis when you don't see any clinical signs in the birds.
Perfect, clear. Thank you.